Hello, this is Yoon Pil Kim, Korean medicine doctor in HJ Magnolia International Hospital. I would like to explain the subject of treatment of insomnia in Korean medicine through this video. First, I will outline insomnia and then explain its physiology, pathology, treatment, and life management in Korean medicine. Insomnia, also known as sleeplessness, is a sleep disorder in which people have trouble sleeping. Symptoms of insomnia include difficulty falling asleep, not able to focus on daily tasks, difficulty in remembering, daytime sleepiness, irritability, depression or anxiety. Insomnia is divided into acute insomnia and chronic one. Insomnia can also be divided into primary insomnia and secondary insomnia. Secondary insomnia is the result of other illnesses such as psychological stress, chronic pain, hyperthyroidism, heartburn, menopause, etc. And it is reported that between 10 and 30% of adults have insomnia at any given point in time, and up to half of people have insomnia in a given year. About 6% of people have insomnia that is not due to another problem and lasts for more than a month. Many people suffer from insomnia, and the number of patients would increase as society advances. Next, I will talk about the perspective of insomnia in Korean medicine. In Korean medicine, it is believed that a person sleeps and wakes up as the energy rises and falls. It means that when Yang rises, you wake up, and when Yang returns to Yin, you fall asleep. On the other hand, insomnia occurs when Yang is too strong and Yin is too weak, so the Yang cannot return to Yin. I have shown this as a picture. Here, the flow of qi between yin and yang is in normal condition. The balance between yang and yin is maintained, so the process of sleep and awakening is normal. But here, the balance is broken and yang is much stronger than yin, so the state of awakening continues. Loss of balance can occur for several reasons. In Korean medicine, the process of identifying these causes is called 변증시치, or differentiation of syndrome. It means that treatments or prescriptions differ depending on symptom characteristics. In other words, different causes mean different treatments. Here I divided the types of insomnia into 6 and will explain symptoms and herbal medicinal prescriptions. First, exuberance of the heart fire. When there is too much heat in the heart, insomnia occurs. In this case, symptoms include palpitation, irritation and restlessness, fever with discomfort in the chest, erosion in the tongue and mouth, reddened tongue, rapid pulse, etc. For treatment, we can prescribe medications such as 황년 해독탕 to remove and pull down the heat from the heart. Second, the case of insufficiency of the heart and the spleen. Thinking and worrying too much, the blood and qi of the heart and the spleen are exhausted, causing heat and insomnia. Symptoms are a lot of dreams while asleep, forgetfulness, fatigue, no appetite, diarrhea, pale tongue with thin and white coating, thin and weak pulse, etc. By tonifying the heart and the spleen, we can treat this kind of insomnia, and Gwibiton can be prescribed. Third, weak gallbladder and intimidation of mentality. Insomnia can occur when the function of the gallbladder decreases, causing emotional and mental instability. Symptoms include fever with discomfort, frequent awakening in surprise, being scared easily, bitterness in the mouth, pale tongue with thin and slippery coating, thin, wiry, and weak pulse, etc. For treatment, we can prescribe Gami Ondamtang to nourish the heart mentality and harmonize liver and gallbladder. The fourth case is exuberance of yang of the liver. Due to the weakness of yin qi in liver and kidney, the yang qi of the liver cannot be controlled, causing insomnia. Symptoms can be feeling of bloating in head, headache, dizziness and tinnitus, dry and stiff eyes, a wiry, thin, long and strong pulse, etc. To calm the liver, to check exuberant yang, 진간식품탕 is often used. Fifth, flaming up of fire due to deficiency of kidney yin. When one is too short of yin qi of the kidney, the relative excessiveness of yang qi is caused, resulting in insomnia. Symptoms are reddish cheeks and lips, tidal fever and night sweat, dry cough, yellow urine and hard stool, a reddened tongue with little saliva, thin and rapid pulse. For treatment, 자음 강화탕 is prescribed to replenish yin to reduce pathogenic fire. Sixth, stagnation of spleen and stomach qi. Indigested foods or stress can prevent the upward and downward flow of qi. The stagnated qi can cause pathogenic fire. We can see gastrointestine-related symptoms such as abdominal distension, headache, oppressed feeling in the chest, limb helplessness. By promoting digestion and removing food stagnancy, the symptoms can be relieved. For this, we prescribe Pyeongwisan. In addition to the causes mentioned, there may be other causes which need other prescriptions. Other than herbal medicine, we can use various treatment methods such as acupuncture, cupping, mind control, Danjeon breathing. Acupuncture is one of the main treatment methods controlling the flow of qi. In human body, there are acupoints regulating yin and yang. For example, Ki1 and GV20 regulate the ascension and descension of yin and yang qi, and CV17, CV6 let the heart and kidney to help and check each other. And there are acupoints regulating meridians concerning differentiation of syndrome cases we mentioned just before. Acupuncture points for each case are presented here. In clinical practice, we acupuncture on Ki1, GV20, CV17, CV6, and acupoints related to each differentiation of syndromes. In case of insomnia due to exuberance of yang of the liver, Do acupuncture on Ki1, G320, C317, C36, and HT3, HT4, HT7, HT8, and HT9. Cupping is another treatment for insomnia. In many cases, wet cupping is applied, which is letting blood with a lancet and attached cups to relieve blood stasis. It has the meaning of letting out too strong or stagnated qi. For example, in case of exuberance of yang qi of the liver, acupoints GB21 and GB14 are used to release the qi in the upper part of the body, and BL17 GV9 to make a passage for qi to go down. I explained earlier that the imbalance between yang and yin causes insomnia. These imbalances are often caused by psychological factors. Conversely, this means that by controlling your mind, the imbalance can be resolved. In Korean medicine, it is said that the heart directs the consciousness of the five organs, thus controls the flow of qi between them. It means that qi flows to where you are conscious, and by leading the flow of yang qi to yin, you can get to sleep. So let's practice control of mind and qi. For warm-up, walk slowly with consciousness on the sole of your feet. It helps to empty the gastrointestinal tract and facilitate the flow of qi. Sit down on a comfortable chair, for example, a sofa, or lie down and relax yourself. Put consciousness in lower part of your body, Kihe or Yongcheon acupuncture point. Imagine that qi flows to where you are conscious. Just be conscious of a part of your lower body. Do not try to force qi down. By doing this, you will calm your mind and qi and fall asleep. Danjeon breathing is a practice similar to mind control. The difference is that the former controls the mind and the latter controls the breath. Danjeon is a place where qi is accumulated under the belly button. The warming up and positioning process is same as mind control. After positioning, put consciousness under your belly button or kihe point. Imagine that qi flows naturally to where you are conscious. Do not try to force it down. Some people can actually feel the flow of qi to lower abdomen. While breathing in, let your lower abdomen rise. While breathing out, let your lower abdomen goes off. Count with each breathing in and out. Count to 10 and go back to 1. Repeat this process. Concentrate on this process. Thoughts and emotions are being switched off. You can get to sleep. When practicing mind control or Danjeon breathing, time varies depending on the case, but it takes about 10 to 30 minutes in mild cases. In severe cases, it might take more time and you need herb medication or other treatments. Finally, I will introduce good habits for better sleep. Do moderate exercise during the day. Avoid excessive activity at night and take a break. Avoid distracting programs on TV or on the internet. Sleep early. It is not recommended to sleep after 12 p.m. Do not overeat. Vegetarian foods such as greens and vegetables are recommended, and you can consume moderate amounts of meat that are not cooked fatty. Foods with a lot of synthetic compounds or fast foods are not good. Eat dinner early. Do not overeat. It is especially good to avoid fatty foods such as meat for dinner. Thank you for watching.